My name is Ouellette. I do not work at a nursing home. I work at Butler Hospital. I'm a registered nurse there. I'm here tonight on behalf of nursing home staff to voice my opposition for Governor McKee's budget, Article 8 and Article 8.4 and Article 10.2. For the last 9 years, I've had the pleasure of working on the Geriatric Unit at Butler, which we call senior specialty. Senior specialty patients are often diagnosed with a neurocognitive or degenerative disease such as Alzheimer's, Parkinson's, and other forms of dementia. Geri patients are admitted to Butler from long-term facilities such as nursing homes for many reasons. It's typically a change in mood or behavior or thought process that disrupts their day-to-day life, causing a danger to themselves and others. The changes I mentioned can be triggered by issues such as the onset of an acute illness like the flu, or more commonly a urinary tract infection. A fun fact, the first sign of a UTI in a person over the age of 65 is a change in mental status. If anybody here is over the age of 65. That includes confusion, disorientation, aggressive behavior, delirium, and even psychosis. That's when they come to Butler for acute stabilization. But how does a person in a nursing home acquire a UTI in the first place? It could be that they're holding their bladder for hours on end while waiting for help to get to the bathroom. It could also be that maybe they can walk to the bathroom, but they can't remember that they no longer have the ability to properly clean themselves after a bowel movement, causing E. coli to enter the urinary tract. Once a patient is stable, we aim to discharge them back to their nursing home. However, it is a revolving door for those patients because short staffing fragments care and it promotes a decline in function. How are these residents supposed to stay out of the hospital if their home is not safe for them? We're neglecting an entire generation and they are suffering with minimal staff to advocate for them. Dan McKee signed this bill into law promising a safer environment to care for our elderly Rhode Islanders, and it is beyond insulting that we are here, again, demanding that he honor this commitment to those direct care staff, the nurses, CNAs, and med techs that you or a loved one are likely going to need care from someday. We ask you to please reject these harmful changes and protect the staffing law. Briefly, if I have the time, I'd like to just share a brief personal experience. My grandmother was admitted to a nursing home on our shared birthday in February of 2020. I facilitated most of the admission process, and as I was leaving, a family member, who I believe it was a daughter, in the elevator told me to make sure you stay on top of them because they're not there. But I think what she didn't understand was there isn't enough people there to take care of them. These people do not neglect care because they've got extra time, they're waiting around. These people are missing their breaks, they're not eating breakfast or lunch or dinner, they're not going to the bathroom because they want to make sure that they get to every single person they're supposed to take care of, so they have to use the minutes of their day for them. And I thank you for taking the time to listen.